So today we have John Roll, who is Senior Vice-Chancellor at WSU, and he's going to share for 10-15 minutes a little bit about kind of how the medical school is progressing, and we're very interested in that because in June, we're doing a World Doctors Conference here, June 11 and 12, and we found that there's a great demand for medical doctors to know how to pray for the sick. It's a great idea. You know, you can, if you're going to work for the sick, it's good to get them healed both spiritually and physically as well. So anyway, that's going to be a lot of fun. So we're looking forward to that. So we're very interested in hearing how the medical school progress has taken place. So let's give a warm welcome to John Roll as he comes up. Thank you.
Thank you. Thanks for the invitation. I wrote it down tonight so I wouldn't get it wrong. They told me I should not speak off the cuff. So I really do want to thank you for inviting us. We're really pleased that you have WSU on your radar and that we could be here tonight. We've invested over $208 million in the campus just down the hill here from you. And on May 6th, we'll have kind of the beginning of another large investment, a $16 million investment in the new Teaching Health Center clinic, which will be going up at the old Peroni warehouse site on our campus. This clinic will allow medical residents in family medicine and internal medicine to serve patients, while nursing students, pharmacy students, OT, PT students from EWU, physician's assistant students from the University of Washington, social work students, psychology students, all practice hand in hand. We believe that healthcare in the future, especially in our climate of austerity, has to be done in a team-based setting with everybody practicing at the top of her or his license. And we want, from the day that students set foot on our campus, to be kind of inculcating that in them. Not to say you don't have to be a great nurse or a great physician, but you have to know how to be part of a great team as well. So we're thrilled about that clinic. I'd like to invite all of you to come to the groundbreaking if you want. That's at 9 o'clock on the 6th of May. It will open by summer of 2016. It's a result of the Spokane Teaching Health Consortium, which is a unique partnership between Washington State University, the Empire Health Foundation, and Providence. This was established in the fall of 2013, and we really wanted to establish this so that we could bring new federal funding into the region to support our efforts around medical residency training. And in a few short months after that, we had 6 additional residency positions funded, and we have 15 more on the horizon very soon. As you may know, Washington State, not the university, the real state, has an uneven distribution of residency slots. We have nearly 1,600 in the state, and 1,500 of them are in the western part of the state. So, so that's an issue. Also, 49% of practicing physicians are in western Washington, where only 29% of the population lives. So we want to help readjust that distribution at both the medical school and the residency level. So hopefully you can see that our commitment to medical education is far-sighted. Not only do we believe that having a second publicly funded medical school is critical for increasing the number of primary care physicians in our state, we know that growing the number of residency programs and slots in our region is absolutely crucial to maintaining the students who we train in our communities and in our rural areas that really contribute a lot to the lifeblood of Eastern Washington. As you probably have heard, if you watch the news at all, we've received authorization from the legislature and the governor to move forward to establish our new medical school as well. Thank you. We're now waiting funding decisions at the state legislature, but we're hopeful given the strong support we've had so far to date in getting the permission to plan. If all goes as planned, we could have our first class of physicians graduate in 2021. That's only 6 years away, so we're very proud of that. The economic impact of a medical school will be tremendous for the community, as they are well known to be a strong economic engine. They attract federal research dollars, they create jobs and the potential for new spin-off companies. And we can talk about that in a minute when I touch on the bridge, because where will those new spin-off companies need to be located? I think this neighborhood looks like a good bet. Meanwhile, I don't want anyone to forget that we have other colleges here on our campus. We have 25% of Washington State University's colleges headquartered entirely in Spokane. The College of Nursing was the first, and I'm fond of saying that if they hadn't been here, we would have a hard time doing what we're doing today. They've kind of plowed the ground for us to be here. The College of Pharmacy is here, and the College of Medical Sciences. We also have programs in nutrition, exercise, physiology, sleep, addictions, psychology, neuroscience, and health policy administration. There's one of our students from health policy administration in the back there. He's going to graduate this fall, so congratulations. Between nursing and pharmacy, we graduate about 1,500 students every year. The researchers in these colleges continue to bring in grants and contracts. We're close to having $150 million in contracts in the last 10 years, or federal grants. So that's a non-trivial number as well. As we grow the university district, the Gateway Bridge becomes more important in connecting us to the South Hill medical community, to housing for our students, and as I said, as potential sites for entrepreneurial startups. We're very excited about the potential. Currently, the House Transportation budget, I guess, is debating the merits of funding that bridge, so we're optimistic that we can get that done. I'm going to put this part away and just diverge for a second and say, I was born on a farm in Montana. I grew up on a farm in Montana. I was actually born in Missoula. And I've been all over the country getting an education. My wife and I have lived in Vermont, Missouri, Michigan, New York, California. When our son was born, we returned to Spokane because this is a great community. This is where we wanted to raise our children. And when I did that, I was leaving UCLA, and I thought, well, maybe I'm going to have a great quality of life, but maybe this scientific career, this academic career I'm on will suffer. That has been the farthest from the truth of anything I could imagine. The community, all of you have embraced what we're doing at WSU Spokane so warmly, and we're so grateful for all of your support, and we really want to be a part of making the community a better place for all of us. So thank you very much.
Thank you so much. Thank you. Yeah, and you can kind of get the gravity of the impact that the medical school and what WSU is doing and planning. It's going to really impact us all here in the city of Spokane, especially in the South UD district. It's time that we change the atmosphere of the Sprague corridor. It's kind of had a bad rap in the past, but it's going to change. It's going to change, and you can imagine when that bridge goes in and the student housing takes place and the medical instrument type companies or research companies begin to come in and things start to happen. It's just going to be a lot of fun for all of us. And we want to play a part in that. And your support is what does that. So.